in the cavities, and it leads to a host of severe symptoms. Typically, death is due to sepsis or central nervous system infection. If you have aggressive management, the mortality rate is now less than 30%. Morbidity, however, remains high, and complete recovery is rare, even with early intervention. And this is just a picture to show you how everything is connected, just like the pipelines in a community or the streets in a community. Everything is connected, so everything can find a channel to spread and to go elsewhere. This is another picture. And then I must say, the head is right here, your lower jaw is right here. What is here? So is it possible for the infection to spread to the heart? Do we think about these things when we're brushing our teeth? No. Right? Okay, so before, the 4 pictures you saw had explained cavities, which is the hole in your tooth or tooth decay. These 4 pictures are showing you periodontitis, which I said is an inflammation of the supporting tissues around the tooth, right? So the first picture, that's healthy. Almost 99% of you in here will have the second picture. That yellow thing you see is plaque, right? As you eat, you're going to get plaque. Plaque is food and spit and everything mixed up together, right? When you don't brush it off or you don't brush properly or floss, it gets worse. And with picture 3, you notice that the gum is starting to separate from the tooth. That's what inflammation does. Inflammation is the body's way of trying to fight or get rid of any intruders, right? And just like when there is war in any country, when you're trying to protect your territory, is war ever pretty? During war, do we have no casualties? There are. So there's a war in your body when we're having inflammation in the body, right? And then the last picture is just showing a severe case. So we did agree that infection can spread to the heart, right? Okay. People with untreated tooth infections are 2.7 times more likely to have cardiovascular problems like coronary artery disease than people with healthy mouths. You remember that first picture, and I said to you, persons with gum disease are 2 times more likely to die from a heart attack and 3 times more likely from a stroke. This is the study to show. I know the reference is not there. You can get it from me afterwards if you so desire. Brother John, wake up. And this is just another research. Let me just read it. It says, research has shown the connection between oral health and heart health. People who have poor oral health pose a higher risk of having cardiovascular problems. Studies have linked periodontal disease, that is gum disease, to numerous health conditions, including heart attack and stroke. How is gum disease connected to the heart? Bacteria build up, and inflammation in the oral cavity, as I've been saying, eventually spreads, right? It leads to the narrowing and blockage of blood vessels. So that bacteria in your mouth can actually spread into your arteries, right? And then if it's an inflammation issue, if anything is inflamed and it has a hole in the middle, the hole is going to get smaller, right? Right? If I do this and my finger becomes inflamed, the space that the air can pass through gets smaller, the lumen gets smaller. All right. Just a quick. Are you hearing it? It's from the speaker. Hold on a second. I guess because it's connected, I can't.
also known as dental caries, is caused by bacteria metabolizing sugar in the mouth and producing acid that causes cavities in the teeth over time. Dental decay is linked to the frequency of sugar consumption. Gum disease, or periodontal disease, generally occurs when ineffective toothbrushing, or an absence of toothbrushing, leads to a build-up of bacteria in the mouth, commonly known as plaque. Plaque is a white sticky substance that develops on teeth and leads to inflammation of the gums, which in turn can affect the underlying bone, leading to tooth mobility, tooth loss, receding gums. Bacteria, or toxins produced by bacteria, can be absorbed into the bloodstream and travel to other parts of the body. There's strong evidence linking gum disease and heart disease. Oral bacteria can be absorbed into the bloodstream via inflamed gums and travel to other parts of the body. This may contribute to tiny clots or inflammation in the blood vessels that leads to cardiovascular disease. Infective endocarditis may result when bacteria enter the bloodstream of a susceptible individual, for example, somebody with a prosthetic heart valve, and colonizes the lining of the heart, which can lead to inflammation of the lining of the heart valves. The disease carries a high mortality risk, and it's thought it can be caused by oral bacteria. There's evidence that good oral hygiene reduces the risk. There's strong evidence of a two-way relationship between oral health and diabetes. Gum disease can lead to poor blood sugar control, and poorly controlled diabetes can increase the severity of gum disease. People with diabetes are also at higher risk of developing oral thrush and dry mouth.
Okay, I'm going to stop it there. So that was basically an overview of what I was saying before, how the bacteria gets to the heart, right? And the issues that it can cause to the heart and how you can end up dying from it, right? Are we on the same page? Okay. This is just a picture to sum up everything. Bacteria from the mouth, it enters the bloodstream through the gums. Oral bacteria can stick to fatty plaques in the bloodstream, directly contributing to blockages. Blockages of any arteries can lead to what? Starts with an S. Can lead to a stroke, right? You can have a cerebrovascular incident, right? Because a stroke is basically when the brain can't get enough blood, oxygen, all of that, right? Nutrients. Okay, so in summary, poor periodontal health. Oh, well, this is actually associated with hypertension. So you heard what they said about the diabetes, and the diabetes is a two-way stream. If there's too much sugar in your blood, can you imagine when you leave sugar outside? When you leave those little packages of sugar outside and it sweats, it gets what? Sticky. Can you imagine that in your arteries? So when you have that stickiness in your arteries, it reduces the blood flow to your teeth and your gums, and so you end up with inflammation, you end up with gum disease. Also, if you have gum disease, you have inflammation, and that can worsen your diabetes as well. So for high blood pressure, there was a study, and the summary of the study was that poor periodontal health is associated with the worst systolic blood pressure profile and unsuccessful antihypertensive treatment. So this is just a way of saying, when you do your pressure, you have a top number and a bottom number. The top number is referred to as your systolic blood pressure, right? So it makes it worse, and it also contributes to your hypertensive treatment being unsuccessful. All right. And I spoke about the stroke already, spoke about the diabetes. This is what I was saying earlier. Diabetes causes blood vessel changes. So the thickened blood vessels reduce flow of nutrients and removal of waste from body tissues. And this reduced blood flow weakens the gums and the bone. This is just summarizing everything I just said to you a while ago. And for persons who they did tests on, for those who have sugar, they normally send you to do a HbA1c test. That's what they do to test what your sugar control has been over the last 3 months. They realized that the impact of periodontitis on changes in your HbA1c, when it was assessed, and it was 2,973 people in the study, they realized that the participants with the most advanced periodontitis at baseline demonstrated an approximately 5-fold greater absolute increase in the HbA1c, which means their sugar was worse. Sugar in the body slows you down, makes you fatigued. Think about that stickiness all throughout your blood vessels, throughout your body. How do we get energy? The food goes, right? And what transports the energy and the air and all the nutrients to the different organs? The blood, the arteries, right? All right. Now, we're coming to a close. The brain. Nobody thinks that oral health will affect your brain physically. I don't mean like the infection I was telling you about. But the mouth is home to about 700 species of bacteria, including those that can cause periodontal disease, right? Gum disease results from infection of the oral tissues holding teeth in place, and the bacteria and the inflammatory molecules that make, and we said this already, spreads into the bloodstream, it goes to the brain. And there are studies that have linked this to dementia. You see it at the bottom there? Influences the cascade of events, the second to last line, that leads to dementia, right? And there's also another one that links it to, not this, links it to Alzheimer's. Thank you, Sister Roma. Links it to Alzheimer's, right? It's not this slide. Okay, I probably left it out. It links it to Alzheimer's as well. So they associated poor oral health with your risk of developing Alzheimer's. And there was a video I was watching online. You know, they say sugar in the blood is diabetes, sugar in the brain is Alzheimer's. Yes, sugar is not. Sugar out of proportion is not good. Unhealthy, refined sugar is not good, all right? And I went through the whole thing about the stroke already, COVID-19. COVID-19. Clinically, they did a study on those patients that were hospitalized and those who died and those who had to go in the ICU, right? And the long and short of it is this table. It's probably a bit small for you, but you see the lighter gray area? Are you seeing the lighter gray area? That is severe or critical symptoms, right? And then the darker gray area is mild to moderate symptoms. Now, do you realize when the person neither had hypertension or periodontitis that they were more likely to have mild to moderate symptoms? That's the first graph here. First one here. You see, notice this is higher. So that's around 67%, and then the lighter gray area is around 23%, right? But when the person had hypertension or periodontitis, the severe symptoms increased. And then when they had both, it increased even further. ICU admission, the same trend was noticed. When they had both the hypertension and the periodontal disease or the gum disease, their chances of being admitted in the ICU was greater, and the same trend applies to those who died from COVID-19. No, this presentation was supposed to be done on the day when Dr. Newman was here talking about prostate cancer. Now, there is an association, researches have been done, there is an association between periodontal disease and prostate cancer. The pooled estimates show that periodontal disease was significantly associated with the risk of prostate cancer, right? And this is just saying the same thing again. Research has shown, that's the highlighted portion, that men who show indicators of gum disease, like red, swollen, tender gums, so if you brush your teeth and it's bleeding, you have gum disease, all right? So that's not normal, you need to see your dentist. So persons who had gum disease and inflammation of the prostate had higher levels of PSA than men without these indicators. Now, you know, PSA is what they use. They have PSA tests, that's how you test if you're having prostate cancer. Now, high levels of them may not be cancerous, it could be benign, but when they're significantly high, then it's an indication that you have prostate cancer, all right? Studies also show that treating gum disease reduces symptoms of inflammation in the prostate. Well, furthermore, men with gum disease indicators as well as prostatitis, which is inflammation of the prostate, tend to have higher levels of PSA than men without gum disease. What do you see coming out through all of this? Starts with an I, not infection, and longer one, inflammation. You notice everything, it's inflammation, inflammation, inflammation. Yes, inflammation. Now, what is this picture of? What does this look like? Like a war zone, right? War is not, well, war is never good, but I can understand why they're doing it because they're protecting their territory, right? And as I said, whenever there is war, you will have casualties. It's not pretty. Fire, right? We have a war zone in our body when we don't take care of it. It's called inflammation. Inflammation is basically your body's defense system or defense mechanism to ward off things that should not be in there. So when you don't brush your teeth properly or you don't brush it enough, when you don't floss, and that food stays in between the gum and the teeth, aside from the fact that when you go in your kitchen and the food in the bin has been there for long and it stink bad, it's there and it's causing an inflammatory response. The inflammation will not just stay in the mouth, it's going to spread to the body. And inflammation, though it's trying to get rid of what the cause is, you're going to have casualties in your body. You're going to end up with all sorts of different diseases, right? Right? Okay, so was the information clear? I know I rushed through it. It was supposed to be a 15-minute presentation at the time. It's just an overview because each of these things that I touched on each one can take a whole afternoon in regards to the link with gum disease, cavities, infection to the rest of the body. Beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth, right? God wants us to be healthy. He wants us to prosper. Whether therefore you eat or drink or whatsoever you do all to the glory of God. So I would like to say, whether therefore you eat or drink or brush your teeth or floss or visit the dentist how many times for the year? 2 times for the year, every 6 months. Do all of this to the glory of God. We need to stop living for ourselves. We need to remember that we're living for whom? We are living for God. Know ye not that your body is the temple of the Holy Ghost, which is in you, which ye have of God, and ye are not your own. So this afternoon was not about telling you how to take care of your teeth. I'm sure you've heard it 1,000,001 times. It's about establishing foundation for you to understand why it is important. Apart from the fact that you needed to get food, I've had patients came to me, the child looked like she was about to faint. I'm wrapping up so Brother Brown can get ready. Is he sleeping? All right. What was I saying? Oh, the child looks as though they were about to faint. Why? Her face was swollen. She couldn't eat. If you can't eat, you can't get energy. You can't get nutrients. Right? If in Mandeville, it rains a lot. It gets cloudy. It gets foggy. If you are stuffy and your mouth is swollen and shut, you will suffocate because you can't breathe through your nose. What are you going to breathe through? The mouth. But we don't think about these things. The mouth is insignificant. We get up, we rinse it out, we're gone. If anything wrong with it, me just got a dentist. Take out the tooth, and that's it. You don't even want to save it. Nothing that God gave us on our body is insignificant and non-important. If it wasn't needed, he wouldn't give it to you. Okay? Huh? 2 sets at that. Right? If it wasn't needed, he wouldn't give it to you. So I want you to bear these things in mind. The mouth may seem insignificant to you, but guess what? Your mouth is the gateway to your body. And when you're witnessing what you're doing, if anybody come witness to me and the mouth smell bad and them teeth look like grunage upon it, me not gonna hear what I say. That's the first thing you see when that's the first thing I see. I don't know if it's because I'm a dentist, but it's the first thing I see when I look at a person, their mouth, their teeth. And I will close off with saying this. There's a very beautiful young lady. There's a very beautiful young lady who came to me when I was working at National Chest Hospital. It was during the heights of COVID. I mean, she was happening, guys. Eyelash. She was beautiful, nice, natural hair. You know, when black people did the natural hair, really pretty. Her complexion was nice. Even we, the staff, was like, wow. and we're all females. All right? So when she came in my chair and she took off her mask, changed not 360, 180. She was no longer beautiful to me because of what I saw. You know, in COVID, the mask hide a lot of things. But once she took it off and you see the teeth, she wasn't taking care of it. But I pity them. I don't blame them because some people, it's just a matter of not knowing better. Their parents didn't know better. They didn't know better. But I have equipped you with information. Share the information. Amen, brethren? All right, that's it for me. I'll just take 3. Brother Roach, you still did, I know your hand was up first. You still want to ask the question?
I was going to ask you to explain the connection between the tooth decay and your heart disease. But you did explain it.
Okay.
But then I just want to ask something. Whenever somebody goes to the doctor and they are suffering from heart issues or prostate issues, do these doctors refer them to dental people to say, let me check this out if you have a connection between your prostate and your heart and your this and your that? Do they do that?
So I can just speak from my experience. Where I work at Spalding, we have a thing called interdisciplinary treatment. So especially those who have non-communicable diseases, cancer, high blood pressure, diabetes, they are referred down to dental for us to do examination, whatever assessments are needed. As a matter of fact, when persons have cancer and they have to do a certain type of treatment, it's called bisphosphonate treatment, everything dentally has to be done before that treatment can begin. Yeah, and people doing heart surgery, you have to make sure that your mouth is free from disease. Yes, brother. Crockett.
Yeah, you said something earlier that really caught me, because I know that strep mutants, those are, that cause a build-up until you see the plaque, right?
Very dangerous. They cause strep throat as well.
Okay, so you said those, if they go down, because it's the same procedure, they would build up that thing until they cause constriction in the arteries, right?
So I normally explain to my patients this. There's a community in your mouth, a community of bacteria. Bacteria doesn't mean something bad because you have both good bacteria and bad bacteria. So it's a community. And just like human beings, we need food to survive. We eat, we digest, we pass it out. Bacteria in your mouth, the more you feed them, the more they multiply. Right? And when they multiply, not just with causing the inflammation, but when they digest that food and they pass it out, what they pass out is acidic, and that's what causes the hole in your tooth. Last question. That's it? Okay, yes. Gum disease. Gum disease, it depends on the severity. So there are different stages of gum disease, stage 1, 2, 3. The very mild stage is what we call gingivitis. Almost everybody in here has gingivitis, right? When you don't get your treatment, and by treatment I mean when you don't floss, I'm going to be honest with you, and this is a bad marketing thing on my part, but you see, if you brush properly and floss, you don't need to go to the dentist. If you're doing what you need to do, you don't need to go to the dentist, and definitely not so often. But the treatment for the first stage of periodontal disease or gum disease is a dental cleaning. Because we go underneath the gum, we remove everything that's there. That's the thing, Even if you take some medication and it brings down the swelling, the cause is still there. So until you tackle the cause, then you won't get rid of the issue. It might just bring down the symptoms, but the cause is still there and the symptoms will come up again. So it's usually a dental cleaning. If it's more severe, it's deep cleaning where you have to get injection. You get a dental injection and we clean one side of your mouth first and then the other side of your mouth. And you have to get medication and medicated mouthwash, and you do a follow-up, and you visit us every 3 months until we are satisfied and graduated to 6 months or 1 year. And inflammation too leads to recession, meaning your gums recede, and your gums won't recede, leave the bone. So inflammation causes gum and bone to shrink away. your teeth start to look longer. The sensitive part of the tooth is exposed, which is the root. So if you look on your teeth and they have two different colors, most times it's the roots that you're seeing. It's a darker shade of brown, right? And then just like when it rains or you remove the soil from around a tree, it starts to waddle, so your teeth start to shake and you lose it. When you lose one tooth, it's opening Pandora's box. So we recommend if you lose a tooth, you have to replace it, or you use the two beside it and the one above as well. And then will lead to the complications of not eating properly, etc. That's it. Okay, so he's asking which toothbrush to use, soft or ultra soft. A moderate and a hard toothbrush is only good to polish shoes and scour toilet. I'm sorry. As well as any mouthwash with alcohol in it. It's only good for cleaning purposes. Cleaning, not your mouth, but anything else in the household. That's what it's good for. And I must tell you that there is more alcohol in Listerine than there is in a Red Stripe beer. Christians, okay. So it must be alcohol free. So if it's Listerine, it must be the purple one. And remember, things are absorbed through the mouth. Christians who are absorbing alcohol. I don't know. I've never looked on that. All right. Any other question? You can talk to me after church. I really don't want to reduce Bible time anymore. All right? So any other questions, I will be here at the end of church. You can ask me. And if you don't get to ask me, you can ask me after the baby come. All right? All right.
Okay, thank you, Dr. Roberts Brown, for that presentation. Did you all learn something? Yes, and I'm sure that all of us take a little look into our mouths. Did we? Yes. And have you found in the balance wanting? Huh? Is there anybody guilty of going to bed without brushing their teeth? And waking up in the morning and eating? Yes, it's like having a dirty plate. The plate that you eat out of last night, put it down and come back the next morning and put food in it. All right? Yeah, that's just it. Okay. So I advocate all the time. The students at NCU, they're always in need of patience. And up to this week, somebody called me and said if I couldn't get some persons to come. So if you're in need of cleaning and examination, please let me know. You can give me your names and your number, and I will pass it on to the students. Different students. So you have the final, it's $4,500. If you have a health card, it is $1,000 something. And if they're using you for an exam patient, it is free. Yes, it is free. And they always have different types of exams. All right, so right now they're preparing, the students who just graduated, they're preparing for their external board exams. And so they're looking for patients to do their board exams, their ADEX, right? And the students in final year, they have mock board exams. So they need students, patients for mock board. And the ones, because they're different year students. So different year students require different types of mouth to do their exams. All right? Not bigger brother cocket, but sometimes they need persons with fewer missing teeth, etc. And also, I'm not taking up the book club time, Sister Alia, but I just want to pass on the information. Huh? Okay, but I need to pass on the information to the brethren. Those who have lost their front teeth, if you're 60 and under, then there is a second chance smile that the Ministry of Health is advocating. So yes. Once you're 60 and under, 18 to 60 years old, if you have 8 missing teeth or less, and you're between that age group, you can go to the nearest health center. You can get a second chance smile for free. If you're between the ages of 18 to 60, you get a second set of teeth. Or should I say third? Yes. All right, so I'll now hand over to the book club piece. But before I do that, Sister Brown, oh, gone down there. So, Brother Nicholas, Brian, I'm going to ask you to just do a little presentation to Sister Brown, all right? She's sitting at the back and you see her condition. She's not going to really want to come up here. So go on, look.
All right, so I just want to. Dr. Brown, I just want to say on behalf of Spur Hill, SDA, we want, sorry about that, Regine. We just want to say thank you so much for that insightful presentation. We learned a lot. And it's like a mini sermon in which we got a wake-up call to take care of our teeth. Right, Regine? Excellent. And I just want to affirm you to tell you, continue to do the good work that you're doing for the Lord, because He sees that you're very passionate about dental health. Continue to spread the gospel as you try to minister in your field. God bless you, and hope you enjoy your gift. All right, nice.